Right. No, absolutely. Absolutely. I mean, the manual therapy, I consider manual therapy effective at control, alt, delete, resetting the system, restoring normal movement. And then the whole next thing is functional motor control.
Correct.
That's what stops it from coming back. And that's when you see people who go to other manual therapy practitioners, no names used, who do a quick intervention and send them away and say, come back in 2 weeks. And they're just an annuity patient. They just keep coming back because they just keep buggering up their neck or their back or their knee or whatever it is, because you're not giving them the tools to properly manage the way the body moves, the education, the proper exercises, specific exercises.
There's certain patients, you can just correct their movement pattern and it offloads the segment and the pain goes away. But there are other patients that you correct the movement pattern, but if you don't clear out what got irritated due to this abnormal movement pattern or an injury,
just going to come back.
Yeah, so it's nice having the manual therapy in your toolbox, which sort of brings us to this debate that's been going on forever, this hands-on, hands-off type thing. You know, exercise is superior to manual therapy or vice versa. It's just the dumbest debate in the world, in my opinion, because why would you, if you're a builder, want to throw out some of your tools? Why would you throw out your hammer because some guy on Twitter says hammers suck type thing? I'd be like, mate, when you need a hammer, it's good to have a hammer, you know? So I think it goes back to the subjective. It goes back to sort of doing a good evaluation so you can work out when you need to use manual therapy. I don't always use it. There are some patients you don't want to use it because then they want to come in and get their little bit of a massage or whatever. But there are, so my thing, what I'll say to these guys who say manual therapy sort of sucks, I'm like, first of all, if I get them better with manual therapy, even if you got them better with therapeutic exercise, why can't I do manual therapy? I got them better too, type thing. So don't tell me something sucks because I can just turn around and say, why are you using therapeutic exercise when you can get them with manual therapy? The second thing is, how are you going to apply specificity and dose to someone who comes in with chronic headaches? This is just an example.
Yeah.
And at C1, you light them up, they've got the headache. What exercise are you going to give them that gives them enough dose? You can sit there and retract and do all this sort of stuff. I've seen people that have done it all. They come to you, you do some unilateral PAs and you hammer away, clears them out. So why would I not want to have that tool in my toolbox? You know, it's the dumbest debate I've ever heard, you know. Similarly, if all you do is manual therapy, when someone comes in